see if we have everybody online. I've just turned on the um, screen so you can see the PowerPoint. Let me ask if you can hear me, if you would all type in the question area, if you'll type in how the weather is wherever you are. Say, I'm from Florida and the weather is great, or it's raining, but just go ahead. I just want to make sure that you can hear me. Okay, sunny, good. Leslie, thanks. Um, Go ahead. So if for those of you listening, if you don't mind typing it in there, beautiful weather in Arkansas. Good. Hi, Tammy. Good. Wisconsin looks good. Cloudy and okay. Sunny. We have Kansas City is cool and cloudy. Great. Anna, welcome. Okay. So it sounds like we're coming through okay, and you can hear us. And we have most everybody. There's a couple more people look like they're still going to be joining us here as we go along. But thanks. We're glad you joined us for this webinar. Online, we also have Terry Christensen, who's the Human Resource Director of Tooele School District. Hi, Terry.
Hi, Jeff. How you doing?
Good. I'm good. Thanks. And sounds like we can hear everybody okay. So we're good to go here. Now, these pictures that you see with Terry and I, we took these last summer at the National Subsolutions Conference that we held up in Jackson Hole, Wyoming. And those are true mountains. That's exactly what it looked like. We just stood in front of them and had our pictures taken. And yeah, one of my favorite places on earth is Jackson Hole. And this presentation we actually did, Terry did up there at the conference, and it was so well received, and there was a lot of interest. We decided to hold it as a webinar, and so that's what we're doing here today. And it was beautiful weather, by the way, Terry. I was up there over the weekend, Friday and Saturday. We went up on bicycles. We drove up and went bicycling through Yellowstone. We did about 108 miles in 2 days, and we only encountered two buffalo was all that were on the road, and we were dressed in red, and other than that we had a great time. So
Oh, I'm
it
sure it
was
was.
all right. Well, welcome everyone. So we'll go ahead and begin. Terry, can you have we let's see, do you have clickable, can you click?
Let's
Yeah,
see.
you can. So use your right arrow and go ahead and move on.
Okay, I'm trying to do that right
uh,
now, and
Not
oh, hold on. I've got to come down into that lower box here to activate that.
okay.
All right.
Well, you're clicking, click on the screen someplace. Okay, does that advance? There we
There
go.
we go.
Good. All right.
All right. Well, welcome everyone. Glad you're with us today. Kind of as Jeff has talked about how the weather is, I've been checking the weather up here in the mountains around us, and it's beginning to snow here in Utah. So feel free to hop on a plane and come out and do some skiing with us all. We'd be glad to have you. What we're here to talk about today is the Affordable Health Care Act and what to expect. Now, keep in mind we are not giving legal advice. We're not giving anything other than heads up and what we know to date in regard to PPACA and what it might be called healthcare reform or Obamacare. And some of those regulations are still being issued, and definitions are still being defined by Health and Human Services, Department of Labor, and the IRS. So as you take a look at the history and see how it's morphed over time, you want to be very cognizant of some of these things that are coming up, specifically what's going to happen in January of 2014. And that's what's really prompted a lot of our discussion, even at the past Steady conference and this webinar today. So I want to make sure we have a great discussion today and going over a little bit about what things you might need to prepare for. Okay, some of the issues that we've come up with here is the individual mandate, and we've had a recent ruling just prior to the Steady conference, which defined the individual mandate to be constitutional. and we'll talk a little bit more about that in future slides here. But there will be some, as you see the second bullet there will be some employer shared responsibility. So we will have some of that responsibility to track individuals, to pay for a portion depending on how things go. And the next bullet with the exchange. Exchange is kind of a different animal. There's only a few states that have an exchange in place right now, and I'm sure there's a lot frantically trying to get an exchange set up in their state. So we'll talk a little bit more about the regulations and the timelines, but there's a lot to this, as you can see. Um, with this next slide here, Pocari, the Patient-Centered Outcomes Research Institute, this is something that there will be a fee assessed, and it will be an annual fee, and that's generally paid for by your insurance carrier, unless you're self-insured. But basically, it applies to grandfathered and non-grandfathered plans. You will probably need to work with your insurance company or your brokers to determine what your status is if you're not aware. But basically, these are some things that, as well of a lot of these other slides, that will basically be helping you determine your status, whether or not you're a large or small employer. I'm assuming that everyone on here is a large employer. So we'll take a look at that as well, and what the fees that apply to the sponsors, but the carrier must file with the IRS and pay those fees. So with that in mind, you need to be talking with your broker, your carrier, so that you have a true understanding of what your fees will be. So in a sense, just like any other business, most businesses pass that on to the individuals, and this goes again to that institute, and they track and maintain data so that they can report to the feds. And this fee is $1 per covered life this year, and will be $2 next year. And they're starting to gather data and prepare things so that as they get into the final months in regard to this act being applied in different levels, then they can provide data and to see how it's running and operational. So as you see on that last bullet there, additionally, plan sponsors have already increased their plans to prepare for the Affordable Health Care Act. And our experience just in my district alone, and I can only speak to that, and as well as possibly a few other districts here in Utah, is as we've gone through our renewal process, we have seen that there's been approximately 4% added to our plan in preparation for that. So let's see, did I go back too far? There we go. All right, next slide here. With the individual mandate, this is a little bit confusing, and hopefully we don't confuse everyone so much, but if you have any questions, again, there will be some websites you can go to at the end. We'll answer any questions that we can, but understand we're not the experts here. We're just trying to put information into your minds here so that you can act on it. So in regard to the individual mandate, this is where an individual must obtain minimum essential coverage for themselves and their dependents. So therefore, if it's not obtained, they'll pay a penalty through their taxes. This was challenged through the Supreme Court, excuse me, and that was found to be constitutional in March, and where it says still waiting for the decision from the court. That is updated to have been right just before study that was found to be constitutional. Generally, the argument is that the government has exceeded its power by requiring a person to have insurance. But we found that to be the case. But in that last bullet there, the Anti-Injunction Act, you can do some research on that. But in a sense, what it says is it's difficult to assess a fine to taxes that have not been collected yet, and that's where some of the challenge has been, is in relationship to the Anti-Injunction Act. So there will be further definitions coming out from that as it gets challenged. I'm sure it gets challenged closer too.
Terry, let me see if I understand. So what you're saying there is they can't challenge the law until actually the taxes have been paid, and so that's why we have to wait till 2015 to even challenge the law, because then the taxes will have been paid. Therefore, then a challenge can be made.
That is my understanding, yes.
Okay.
Okay, we ready to go on?
Yes.
Okay, so the individual mandates based on a 30-hour per week average, and you'll see the next bullet there, 50 or more employees. I'm sure everyone in this group that is with us today has 50 or more employees. So unless you're a really, really small district, in which there probably might be some, um, that would apply a little bit differently to you. The employer shared responsibility is kind of a player pay thing. You'll see that as you look at the data in regard to the Act, but it has provisions that the districts or the employer must provide affordable insurance to full-time based on the hours in the week employees to be exposed to fees and penalties. So you ask possibly what is affordable insurance? Well, we'll talk about that in some of the future slides here, but it gets into a proportion as far as the earnings of the individual. So again, the last bullet there, based on average with provisions for full-time, part-time, and seasonal employees in a look-back period. The threshold for this is set right now as of 120 or more days at 30 hours a week. What's going to be a little bit more difficult for, and I'm looking at this as well, how am I going to track all of these subs to determine if they qualify? And if so, then what? Then what do we do? So it's going to be tough to do once they qualify, and then well, let me go back here. I think I pushed it too fast. So once they qualify, then you have a look back period, and 12 months to use as a measurement period. So as you look at, okay, how am I going to track? Yes, there will be some questions, but I think what they're saying here from the qualification period to the measurement period to the I'm trying to remember the other one. I've got it here in a later slide. The measurement sustainability period is that they want consistency. So if you set a measurement period at X months, then it needs to be the same for the sustainability period, but that'll be better defined as we get closer. The employer must be consistent with employees on the measurement period, so just like I had mentioned, and figure how many hours worked during the period, and after that is the stability period. So that helps us to make sure. I'm looking at this. I was quite worried initially as the Act came out, wondering, how am I going to track it? But this does help. But then again, it still is some questions out there as far as, okay, now do I, if I go through the measurement period and I get to the sustainability period, what do I do then? Well, we'll talk a little bit more about that, and you'll need to work with your brokers individually. But okay. So the amount of hours worked in the measurement period is applied to the stability period, so that's where that consistency comes in. So regardless of the hours worked in the stability period, during the stability period, that the employer or us, we need to worry about the benefits to all current employees who met the hours required in the measurement period or pay the penalty or opt out. So pay penalty, decide if the penalty is worth paying, or opt out. Or do you limit the number of hours that a sub works? Okay, so there's a couple of options. Some are making the choice as to whether or not you have individual subs on as independent contractors, or do you outsource? So that is up to you, and we're going down the road of looking at different options for our district as well. Okay, penalties. We all love penalties, and of course, when we get some of these, some of the federal legislation that comes our way, there's usually a penalty, and if we don't comply. But for the penalties with large employers who offer all full-time 30 hours coverage, but the coverage is not affordable to the employee. And that's defined as a premiums that exceed 9.5% of the employee's household income. The tough thing for us is going to be, well, how do we know what the employee's household income is? So you see, here's another level of question in regard to how is this actually going to be applied. Because in a sense, you might have two employees that work for you. Well, then that's easy. You can determine that. But if you only have one, you only see half the picture. So um, you would probably have to rely a little bit more on federal resources to get that household income. So that'll be better defined farther down the road. Household income is defined as W-2 income. So a large employer offers coverage, but the coverage does not pay at least 60% of actuarial value of the benefits provided under the plan. Okay. So therefore, if you pay your sub, we did a little calculation here. If you pay your sub $8 for an average 30 hours a week, that would be $12,480 for the year. At that 9.5%, it'd be $1185.60, which means a max of $98 employee premium. Okay, so I'll only have to provide single coverage. It's not mandated that we've seen so far that you have to do a couple or family coverage. Okay, so penalties. I'm sure there's some questions about the penalties. You ready for this? Uh-oh. I seem to have lost a little control. Oh, there we go. So, and I figured this out to be a couple of $1,000,000 for our district if we applied this directly the way it is. Penalties, $2,000 multiplied by the number of the employees in the organization less the initial 30 employees. Basically a ton of money. Okay, we don't have money. We're in public ed. We're in education somehow. We know that resources are not easy to come by. So how do I pay it? Or is that part of the opt-out option? Okay, the penalty is assessed against large employers when the coverage is offered but not affordable or does not meet the minimum standard. Okay, here's another layer of complexity that you will need to address as you design what you're going to do with your plan, because some of you may have fully insured plans, some of you may have self-insured plans. If you're not sure what I'm saying there, fully insured is if you pay a company to manage your claims for your medical expenses, and if you're fully insured or self-insured, then basically you are the insurance, and if they're as claims come in, you pay those claims directly. So anyway, that's a quick little explanation there. So now it becomes $3,000 times the number of employees who go to the exchange. So, well, okay, they go to the exchange and they qualify for and use the premium tax credit. So we'll take a look at that here on the next one. So again, the penalties only apply if an employee qualifies for and uses the premium tax credit in the exchange. Now, you may wonder again, what is this exchange that we've been talking about? Every state is mandated to have an insurance exchange in place. Now, Utah, I know where we are at, where Jeff and I are at, has an exchange in place. I believe there's two, probably maybe a third other state that already have them in place, but I think it's well beyond time to get that in place. So I think people are scrambling to get that done. Okay, that looks like there's a question for you, Jeff, to be able to get a copy of the slides. So yes, the exchanges you don't have to worry about. It will basically be something that the state will need to provide. Did you have a question, Jeff?
Sorry, no, I just posted, yeah, I got the question. I just posted the link to download. If you haven't already, it came out in the email where to download the uh, presentation, and so I sent that. Did everybody get that? So
Okay.
I just sent the link out. Okay.
Okay, great. So what is the premium tax credit? It is to assist the individuals for whom the cost of obtaining health coverage is too high. we might have some of our paras or our aides or our subs in this case that having the healthcare coverage is too much for them to bear. So they would go to the exchange and they would apply the premium tax credit and what that like tax and the reduced cost for the individuals in the exchange. If the employee uses the exchange, the employer will pay the penalties under shared responsibility. So it seems like one way or the other, we're going to be on the hook for something here, and that's why there's the argument out there. Well, if you were to do independent contracting work with all of your subs individually, then that might take care of it. Yes, that probably would. The same thing if you decided to outsource, so that would probably be something you have to decide within your district. So what is an exchange? Probably a little bit more definition here. An online marketplace for health insurance for individual and small markets. That would probably be your small employers or very, very small districts. All states must have it in place by January 2014, which is when we're really looking at having everything in place for us. So there again, only a few in place now, and if they don't establish, the feds will come in and they'll establish and run one. Did you have a question, Jeff?
Yes, thanks. The question came in, $2,000 times the number of full-time employees, and how do part-time or seasonal figure in?
Okay, well we're gonna go through that a little bit. It's a little bit farther in the slide too, but um, this is where you'll have to determine whether or not it's a full-time equivalent. So it gets you thought it was convoluted. It gets even more so. But our understanding is based on our discussions with our broker is that it's $2,000 for all the full-time equivalents. So then you have to get into the calculations as what is your full-time equivalency. So we'll talk a little bit more about that farther back in the discussion. So hopefully that helps.
Great, thanks.
Okay. So let's talk a little bit more about the exchange. What kind of employee will qualify for the exchange? Full-time employee not offered health coverage, or a full-time employee is offered health coverage but is not affordable, and so you get into the ands and ors here. Not affordable, and a full-time employee's household income is between 133 and 400% of the federal poverty level. Kind of like on the last slide, have you had enough yet? Have you? It does seem a little bit daunting when you're starting to look at these things here. So if you're going to look at the 133% of the poverty level, the employee qualifies for Medicaid S-chip, not the tax credit. So that is if they're below the 133%. If the income is above 400% above poverty, then they're not eligible for these subsidies. Excuse me. So in regard to this, I put down a couple of calculations. So a family size of one, federal poverty level is $10,890 in income. So if you take that and 133% is 14,484, and the 400% would be 43,560. So that helps you determine household income between the 133 and 400%. So say if you were to go with a family size of 2, poverty level would be 14,710, 133% would be 19,564, and 400% would be the 58,840. So boy, I don't know that there's a lot of people out there that only have that situation, but it seems like it's going to be daunting to try and track and keep track of it. In my district, I can just speak to this, for myself, but I know a lot of other districts my size, if not larger, have had to employ a full-time insurance person. This would fall right within their lap, as well as the coordination with myself and my subs and my sub coordinator to try and figure out where all of these people are, and again, with not knowing what the other part of the family household income might be, it makes it even more difficult. So Jeff, I think, is this one yours?
Yeah, yeah. We'll just mention here in June we did a survey from here at steady.org to managers of substitute teachers asking about what they know about the healthcare law. 78% were unaware of any portion of the law. Only 16% of the districts even thought about the impact on the school district. That one reason we wanted to do this webinar is just to bring it to the table, just to talk about it. And of all those who we surveyed, none of them actually had any plans in place. And if it's to be implemented January 1st of 2014, that's a little over a year from now, but it'll the beginning of school. Almost all these have to take place at the beginning of school, so by next July, and so that'll be a challenge. And anyway, so that's what we found in our surveys. We also found that 43% of the districts have more than 15% of their substitute teachers working 30 hours a week or more. And so there's a number of districts who this will actually impact with their substitute teachers. 100% of the districts have substitutes working more than 30 hours a week. So every district has some working like uh, that do qualify that will have to be addressed. And 92% of these respondents said that they didn't offer health insurance to substitute teachers right now. I don't know if you have, or if your district is offering health insurance, which is already covered, and this law won't affect it. But 92% of those who responded to the survey stated that. So that's what we found in this recent survey that we did in June.
Okay. Well, we're one of those. We're one that doesn't offer health insurance to our subs now, with a caveat that we have in some of our larger buildings that we have full-time subs, and we do offer benefits to them. But as I take a look at where we're at, we did a survey so that we could respond here to the survey within our district, so that we could respond to steady. And we were right there. We had about 30 to 40% of our subs, because we try and keep the pool at a level where the ones who make a career out of it, that they have enough work, but it doesn't get so diluted that that you don't have enough coverage for those times that you need subs. So yes, we were right in the pack here with this group. So okay, essential benefits. There's not, from what I have seen yet, a set federal definition yet, but I'm sure that will be coming. It might even be coming any day now. But states and exchanges may choose how to define that benchmark plan. So basically, a baseline benchmark plan, and what that will do is that will be the defined benefit plan for your state and how it applies to this act. So after that state sets a benchmark plan, all other plans are judged by that plan. But keep in mind, this next bullet here, specific services must include kind of a minimum here. Ambulatory services, hospitalization, mental health, emergency, maternity, prescription, rehab, labs, pediatric, preventative. So there's a lot that it does need to have in place, and I'm sure insurance companies are salivating over that. So health and human services, that's what the HHS is there, will develop a standard for cost sharing. So, and this is their system that they have out there right now. So you might fall somewhere within this, but a leveled system, a bronze package, 60-40 plan. I think you understand what I mean by that. 60%, 40%. Silver package at 70-30, gold 80-20, platinum 90-10. For us, we just graduated down from a platinum to a gold package because we couldn't afford to keep the platinum package anymore. So we offered our platinum package as a buy-up. So anyway, the last one, catastrophic plan, nothing set for this yet, because there's too many things to take a look at within a catastrophic plan, because what are your limits for that? What is it applicable to there? Okay. Exchange rules. and this you'll see when they get into the real nitty-gritty of some of the communications that you have to have out here, gets a little bit challenging. Exchange rules: they must charge fair premiums for other factors. That would be age or tobacco use or geographic rating within a state. Their tiers for single, couple, or family. The waiting period must not exceed 90 days. No pre-existing limits are allowed. Now, some of you may be asking, well, how could they charge different premiums for, say, tobacco use? And what we've seen as far as there have been challenges in regard to employers and districts saying, you know what, if you are a tobacco user, then you're going to pay X number higher because you are, in a sense, possibly a higher user of the benefit. So that has been challenged and has been upheld by because there is a true factorization to some of those factors. But let's see. Okay. Again, these plans must provide documents in easy-to-read 4-page, 12-point font standardized format that summarizes the plan costs and the coverage for comparisons. Okay, so all of your individuals will need to see some of those fair comparisons so that they can choose. And then there's a link there for the frequently asked questions on Department of Labor in regard to that. So the carriers, for the most part, you sit down with your carrier, they're going to do most of the work. You'll just need to track those individuals within the measurement and sustainability period and then offer the insurance as defined within the law or pay the penalties. So that's where you get into the opting in or opting out and what the penalties might be. Okay, it's time to deal with it. The recommendation here is that we need to start getting some plans in place. Jeff, you had a question.
No, I was just saying that that's our comment around the office is whenever there's a problem, it's the response is deal with it, and we have to deal with it. It's just one of those things that we have to bring up and talk about. And I've noticed that as I've talked to providers, health insurance providers and so forth, they're a little leery to even bring forth information right now because it is changing so fast as the implementation of the law comes closer. The definitions are coming out and things are changing so quickly that they can't print up anything and feel comfortable that it'll even be that way in a month or 2 or 3 months. And so it's a little difficult to plan ahead, other than we need to bring it on the table and to start to address it within our school districts and talk about it with all the parties that need to be, with the attorneys, with your health insurance providers right now, and seeing what they know and going from there. And go ahead, Terry.
Oh, okay. Well, that is right. You need to work directly with them because they're going to need, I'm sure, if you choose to keep your subs um, within your district and not as an independent contractor, then that's going to mean that you're going to need to track a lot more data for them. Did you have a
There,
question, Jeff?
there is a question that says, are you going to define sustainability period options? Do you know?
Well, okay, so here's probably a little bit closer definition. If you're going to have a measurement period of 3 months, then your sustainability period will need to be 3 months. We're trying to align our personal, within our own district, our sustainability and measurement period within our retirement system. Because if people are meeting this guideline in regard to the Healthcare Act, then that's going to have implications for us in our retirement system. Because in our state, there's a 6-month period in which they have to work 20 hours or more. So at that point in time, that's what we've said is the measurement and then the sustainability period. So as we meet the end of the sustainability period, then we have another task to do, is to go back and evaluate individuals for another benefit, which would be the retirement system. Because Matter of fact, and I'll just speak from personal experience within our district. I don't know what your states have in regard to qualification, because I've listed a lot of my subs as um, not eligible or benefit ineligible for a retirement system, for the retirement system benefits. But if they work consistently more than 6 months at 20 hours or more in a week, then that we have had to go back and pay our local retirement system for individuals who have worked consistently more over a 6 month period. So I say this as just our own personal look-see at this and saying, okay, if I were to have, this measurement period, then the sustainability period, they just had to be consistent. Could be 3 months, could be 6 months, but there will be, better defined regulations coming out in regard to that. But I think the key is consistency.
Wouldn't it be advantageous to use 12 months look back period on subs? They wouldn't generally work 30 hours a week during over the average of 12 months due to summer break.
Sure. Yeah, that's always a provision that you would need to look at too, and we have to look at that as another level, as we have individuals applying for unemployment, as I'm sure all of you do. You're probably all shaking your heads right now, saying yes, I do that too. But that's another level that we've had to do. So yes, a 12-month could be a very viable option for you as well. Did that answer all the questions, Jeff? I can't see them. Okay, Jeff, are you still there?
Sorry, okay, sorry, I had muted myself, and I've been talking. I don't know why you couldn't hear me. Okay, good. Sorry. Even though Terry and I sound like we're close, Terry's down at his office in Tooele and I'm up in Logan, so we're about 120 miles apart. So anyway, I don't see what he's doing, and he probably is wondering what in the world I'm doing. Okay, so let's talk a little bit about the options here. You've mentioned limiting to 30 hours a week or outsourcing. I did come across a presentation by an attorney from an attorney's office under for independent contractors substitutes. Now this is pretty small. You're going to have to read it on your handout. Um, but they said, can a substitute teacher be an independent contractor as opposed to an employee? And here from the labor laws, here's the multi-factor test where there's behavior control, whether there's financial control, and the service is performed. And so by going down the checklist and when and where do they work, what kind of equipment will they use, what workers to hire, so forth, the quality of work. And so by answering and going through these, you can look at, and this is something you would do with your attorneys to make sure that they do qualify. But according to this organization, they say substitute teachers, if they were assuming the school currently treats the substitute as an independent contractor, they only compensate provided is based on a daily or half a day rate. The substitute is free to accept or decline the offer. Sometimes they work for the school on multiple days in the week. Other times they may not work at all in the month. They work for multiple schools, both private and public. Sometimes the substitute teacher follows the lesson plans left. Sometimes they provide their own. Uh, there's no contract with the school. They provides summary at the end of the day to the permanent teacher, and they're evaluated maybe by the permanent teacher recommendation if they come back or not. So these are some of the things. If a district treated the substitute that way, according to this organization, yes, they would qualify for the multi-factor test to become an independent contractor. And But again, it would be recommended that you sit down and really look at this in the relationship with your substitute teachers and if it's beneficial for them and for the district. Also, if here it says be careful, if they become in a long-term assignment, then they would have to be a temporary employee and not necessarily a independent contractor. But that was kind of interesting that it came across this presentation, and that was their um, oh, suggestion and recommendation that maybe they could become an independent contractor. Terry, any questions, any comments that you might have?
Well, one of the things that I've looked at recently is independent contractors and also to outsource. Independent contractor, that means what are the implications there? So I would need to, if I'm going to go in that direction, or even just for planning to see what it would look like, work with our attorney to say, what does it need to look like? What does this contract need to look like? Because we use a filling software, that helps us fill our assignments. So they can choose whether or not they're going to work. So that has implications there. But what would that contract look like? Now, for the most part, yes, they do have lesson plans left there, but they might not. So you've got to kind of look at what's the consistency within your own district to see how many of those things within the multi-factor test that you would end up qualifying them under that. But we have all the time, and I'm sure everybody else does, long-term assignments, whether it be for an accident, injury, illness, childbirth, whatever it might be, that when those things happen, you need to be cognizant of that because it might have implications farther down the road. So in regard to this, the only thing I guess I would have is any more questions. The only thing I would throw in as a caveat, while maybe people type in questions, is watch the news or work with your carrier. Start to talk with your district and get some plans in place in case, because I know for me, as soon as I saw this, I started talking about it, and I think it was not this summer, but the summer before it, steady, when we started to talk about this because we saw it was coming, and I think now that we're getting closer, people really, really need to pay attention to it. So again, there's a lot of information out there in regard to the Act, the timelines, the deadlines, but all we're here to do today is to raise awareness so that you can do what you need to do with your subs to decide whether or not you want to have stay status quo. You're going to do independent contractors, or you're going to outsource. There might be some other options out there that I'm not aware of, but that would one way or the other, you need to gain a plan, and that's my recommendation.
Great, thank you. If there are any more questions, please feel free to type them in. As we're waiting for those, let me just do some housekeeping items. There is, want to announce the next webinar that we'll be hosting will be a month from today. Will be on October 23rd at 1 p.m. same time, 1 p.m. Eastern time. That's what this is. And how to make change happen within the district. We have Dr. Mark Benini. He was the superintendent. He is the superintendent of schools from uh, Meriden, sorry, school district, public schools in Connecticut, and Thomas Gerard, assistant superintendent. They presented also at Sub Solutions and gave a very interesting presentation. And what I was most impressed mostly about is how they got everybody on board to make the change. And so that's what they're going to talk about. It'll be a short one, probably about a half hour, and it'll be a free webinar. And so that'll be coming up in October 23rd. Here's some questions, Terry. Can you go back to the implementation date? We have September 1 plan. Let's see. So yeah, so we have a September 1st plan year. So are we September 1st, 2013 or 2014? So
Okay, what we're looking at is we have the same thing. We have a September 1st plan, so run September 1, August 30. And there are very specific things from what we've gained from our carrier and our broker that since the plan starts before then, that you need to have a lot of these things in place so that because you're not going to make plan changes come January. So a lot of those things need to be in place for this coming September if you're on a plan that starts in September. So I'm just like you. I've got to work now with my insurance committee and whoever you have in the decision-making line of authority there with your superintendent, your board, etc., to get these things in place for September. So that means that yeah, if you even back it up a little bit farther, as you get your renewal rates probably around the first of the year and you start looking at your plan design, you need to start having your plan design finished and in place so that when you have your open enrollment in March or May or whatever that might be, that those things are there and ready to go. So as you take a look at all of this, and I'm again like you, I'm a 9-1 plan design year. I've got to start doing things kind of now so that come March when I start setting dates for my open enrollment, that's all in place. So we're really, really tied to the feds and the decisions that are made. Might even be some changes come as agreements are made, and possibly any changes in the elections that might have some uh, indication there of what somebody might have a different view of the way that it needs to go, or somebody might change, the act might change in a little bit. So yeah, we've got to watch it and watch it pretty closely in order to make some good decisions for next spring, because that's what I'm looking at, is just like this person indicated.
Another question is, how would you recommend limiting hours on substitute teachers? Is there a responsibility to keep track of the hours? Uh,
you
anyway,
know that is a loaded weapon there. That that's going to be tough to do. Quite honestly, I don't know how a person can limit that, because you would have to have daily control over individuals to look at how many days they're doing. And me personally, I don't know how I could do that on a couple levels. One is I don't have time to look at every individual every day to see if they're going to go over those dead or the time frame, the 30 hours. But I don't know. I don't know how to answer that, because I don't think I could do it.
yeah, that'll be a challenge, but I think it is on the employer, not the employee.
Yeah,
Yeah,
it is our charge to track those things, so that would be a challenge. And that's, in a sense, since I don't have an answer for that, I've got to start
yeah,
looking in other realms.
yeah. Another question is, how will the exchange work when a company is in one state and outsources subs for a district or in another state? And I think that might be that might be answered as the law comes closer to be implemented, whether how they'll deal with interstate commerce type thing. And being able to handle that. Also, it would be not necessarily the districts uh, anyway, that will be when a company has employees in multiple states, I think is maybe the question here, which a staffing agency, for example, might. And so that'll be interesting. I don't know if we have the answer.
Well, there's not one definitive right now, because the Anti-Injunction Act, which was just challenged recently, that was a concern, and that was challenged, and they made a decision on that. But it does have a lot to do with interstate commerce, because there are carriers that cross state lines. We have a lot of carriers within our district or within our state that cross lines. So if you are a district that crosses lines, or maybe better defined, we have schools within our school district that we are on the Nevada border. So in some cases we have employees coming from the other side, and we have healthcare services extended to the other side of the border. It's going to mean a whole different ball of wax for us too. So we just have to watch that a little bit closer. But you have to think about those things, because that could complicate what your plans might be, especially if you cross state lines, or uh, accept individuals from across state lines, or possibly having, again, healthcare coverage extended across state lines within your plan.
Thanks. Let's answer one more question, and then we'll be time. I may have, this question says, I may have misunderstood something I read about, but I thought that when we calculated your part-time and seasonal, you didn't have to figure them into the calculation for the penalty. Is this correct?
Okay, could you restate that, Jeff? I only caught
Well,
part of it.
when calculating your part-time or seasonal, you didn't have to figure them into the calculating the penalty. But isn't it FTE and not just?
Yeah, my understanding is that there is a full-time equivalency. So, I didn't put any examples up there because we have a myriad of people who work just under 20 or over 20 but under 30, and then some who work over 30 and under 40, and some who work a little bit beyond that on occasion. So I would take a look at that specifically and see, because there is a calculation for your full-time equivalency. I don't think it's going to be so narrowly defined as to being your part-time individuals like that,
I see.
if I understand the question correctly.
Okay. Well, very good. The time's done. I did want to mention one more thing before we close off. We currently Steady's offering this our sub appreciation giveaway for the fall 2012, and so your substitutes can go to steady.org/giveaway and register to win one of the prizes that we're giving out, and it goes through. Well, the winners will be announced October 1st of this year, so they have the rest of this month. And so if you haven't posted it on your automated system and haven't let your substitutes know, please let them know. They need to come to the site and register to win. But we want to show appreciation, and we encourage you to let your substitute teachers know that they can participate in that. There's no cost to the district or to the substitute to participate in this. So we'd love to have you have your subs enter. Well, thank you, Terry, for your time and your information you've provided here, and thank you all for participating. And if you have any ideas or suggestions of what you'd like to hear in the future, please let me know, and we'd be glad to schedule another webinar as well. So again, thank you all, and Terry, thank you.
Thank you.
You bet. We will talk to you soon. Thanks. Bye, everyone.
Bye-bye.